Hi, my name is Derek Lindia. I'm a pharmacy student at the UConn School of Pharmacy. I'm here to talk to you today about patient and 62-year-old Asian female admitted for chief complaint of abdominal pain. I reviewed the CMP. It showed everything was normal besides the BUN and creatinine ratio, which was slightly elevated with a 26.2. The total serum protein was slightly low at 3.4. I also reviewed the CBC differential. The WBC was high with 19,300, and the segmented neutrophils was also high in the CBC differential with 81%, and the lymphocytes were low with 23.9, slightly low. I've reviewed the liver panel. The ASTs were high. The ALTs were high, but then came down to normal. The bilirubin direct was high as well with a 0.7. So I just want to go over some of the problems today, starting with Vanco dosing. There was no dosing given, so I would recommend that Vanco be dosed orally, not IV, and I recommend giving 33.7 milliliters, 125 grams QID for 10 days based on FDA dosing. Second problem was the patient's BP was high. Patient's BP was 145 over 58. I recommend starting the patient on propranolol 20 milligrams by mouth twice a day. This is going to lower her blood pressure. It's also going to help prevent the varices, and it also might help with the patient's anxiety. As the problem number 3, patient's pain med regimen. Patient is currently have active dosing for active meds, Percocet 7.5 and Norco 7.5. On the last assessment of the patient's pain, which was 8 hours after stopping the morphine drip, she gave a pain level of 1, so I think that the pain meds should be discontinued. Next problem was with the LMWH treatment therapy. It's strongly recommended that LMWH therapy be continued for patients who are going to be on liver transplant list. I know the doctor sent it out for to consult with the transplant list, but I think the patient should continue on LMWH therapy until the transplant decides that she's not going to be on the transplant list. Missing indication. The fourth one is missing indication. The patient is currently taking Prilosec 40 milligrams daily. She has no indication of GERD, so the patient should be reassessed for the need for Prilosec and be given an indication of GERD or discontinue the Prilosec. And the last problem that I recognized today was the missing medication. In the notes, it said in the med notes, it said to continue home medications for treatment of her depression with anxiety, but there was no active medications listed for it. So I would recommend that we talk to the patient and call her home pharmacy and obtain her current medications, and then refer her to the psych to see if they should be continued or upped. And thank you.